right, welcome everybody to Between Two Pastries. This is Nicole.
Hey everyone, it's Annie.
Yay, yay, yay. Today we have a special guest. Her name is Jennifer Melcher. Welcome. She's a registered dietitian and specializes in child and adolescent disordered eating, eating disorders, and general mental health disorders. So needed, so appreciate you. She has worked with all levels of care from inpatient to outpatient, and she's currently employed at Rogers Behavioral Health located in Wisconsin, and has also started her own practice called Jen Melcher Nutrition. Way to go. She has a passion for educating families who are supporting their child or loved one during their journey to find food freedom, leave diet culture behind, and develop a great relationship with their body, which is awesome. And parents need so much support around that too. It's just as hard on the parents going through it as it is on the kid. You know, right. In like different, it's like a tandem thing, you know, just so interesting. Sorry, like it's not even done with your bio yet. She is a firm believer that all foods are appropriate in any lifestyle and do not label foods as good or bad. Yeehaw! Mm-hmm. So welcome, Jen.
Thanks for having me.
Yeah, it's a topic we need to talk about, right? Is this the connection between parents and their kids and food?
Yeah.
Right. Like it's something's going haywire there because obviously thank God for Jen, because she does all the kids stuff and I can then do all of the adult stuff and not do the kids stuff. As much as I don't mind it, it's wonderful. But it's amazing. Like my mind is blown, even working with the adults who've experienced comments from parents when they were 20 years ago, 40 years ago, that they're still living with. And it's comments around food, it's comments around body, it's comments just in general, which we've talked about on this podcast.
Yes.
But now it's time, I think we need the education and the conversation to incorporate a dietitian who works specifically with kids and what that impact is and what someone's dealing with on the kids side of things as well, like what that looks like.
Oh, for sure. You know? Positively. Yeah. Jen, what do you find on that end? What do you find with kids coming in? Mm-hmm.
A lot of the kids now too, like even in like clinic, I've noticed that of course it's kind of starts with the parents, not always, of course. But it also starts with going to their primary care physician. I've also seen that too, where they go in for a check for their acne and their dermatologist says, cut out wheat, cut out dairy, cut all this stuff out. And all of a sudden now you're into a full-fledged eating disorder because somebody that you go to for professional help tells you have to cut these foods out to make your skin better. You don't need medications, right? So even from the physicians to the parents, it's diet culture all around us, right? It's, you know, the parents at home are doing keto or doing gluten-free, cutting out carbs, all of the above, right? Or drinking all the green smoothies.
Right.
What happens then? It trickles down and the kids start to see that. And it's like, well, if they're not eating that, then that must mean I shouldn't be eating that. And it just starts some of these like disordered thoughts. And it's not really talked about. Right.
No.
And sometimes when parents or like when kids do have a question like, well, why can't I have a second piece of cake? It's like, oh, well, it's unhealthy. Everything is unhealthy. Right. And it kind of starts with that. You have to start to think, what does healthy and unhealthy mean? Right. So just starting to see a lot of that starts with the parents, and the parents have to be on board too. With eating disorders, there's all this lingo behind it saying, why can't they just eat? Why can't they just, go out to a restaurant and pick something off the menu? They don't quite understand that it's an actual like illness that needs to be treated with therapy. That's just like if your child got sick and got diabetes or cancer, it's not like you'd be like, oh, I can just fix them at home. Or, they need treatment, they need help, they need education
support, you raise a really good point, just mentioning like if your child is diagnosed with cancer, you all of a sudden you drop everything and you go through, you go to chemo and you do all the things. And yet with eating disorders, or sometimes many psychiatric illnesses,
right.
there just isn't that rush on this stuff. There is, well, no, we got to hide it. We got to bury it. We got to,
yes.
try
Or
to,
there's an irritation with it.
irritation with it.
Mhm.
Yeah.
Oh, I'm just
like,
so irritated because, like
Right.
my kid won't eat and blah, blah, blah.
what do you
And
mean
then,
you're anxious about food?
yeah. And that
Right.
irritation comes out then, and the child feels that, and it's like more ammo that I'm not enough. I'm not doing the right things. I'm disappointing, or whatever else.
We had a kid recently, if you recall, who didn't even want to, we recommended you for outpatient, I think it was, or maybe it was Megan Driscoll or whatever, someone in the area, right?
Yeah.
And she was not willing because she doesn't want her mom to know.
Oh, wow. Okay.
Because mom was, it was, what was, I don't remember the word she used, but it was like, it was embarrassing. Disappointment.
Yep. My sister had an eating disorder, and I don't want to put my parents through that again. Yeah. Yep. Just didn't want to.
But what people don't realize is eating disorder, sure, okay, eating disorder, full-blown diagnosis, or even disordered eating, it doesn't come as a singular thing. It's accompanied by anxiety, depression.
Right.
The worse it gets, the more OCD that's going to be
That's
thrown in
correct.
there. And that's what people don't realize is this stuff with food directly impacts our brain.
Yes.
But as a child, it's going to impact our brain even more. Right.
Yeah. Yeah.
And there's just like you said, an irritation, disappointment, embarrassment around all of this stuff, or a lack of understanding.
Or like, my parents don't believe me.
Right.
Yes. Yes.
Attention, we think it's attention seeking.
Oh, absolutely. And I think that's one of the key things is the lack of understanding, and it makes everybody very uncomfortable.
So we have to assume, and correct me if I'm wrong, that the response of those types of thoughts and feelings around kids who struggle with eating or maybe eat too much or aren't at the right weight that, parents think they should be at, all of this manifests from generation to generation, right? Like this whole concept of my parents made me finish my plate. And so now there's this like routine in me to make everyone finish their plate. And it's that realization that maybe my 5-year-old isn't still hungry.
That's right.
And that's okay. But I think, so is all of this, behavior or rhetoric towards food related to generations of how now millennials and Gen Xers are as parents?
Yeah. Well, I think that certainly can be part of it. I mean, I'm sure you see that as well, Jen. And I think I know when I think about it too, it's sometimes the parents are just, there's a lot of control there versus working with their kid up. This is their body. You're actually not in control of their body and how their body is operating currently. And, as we know, and again, with childhood development and how children eat anyway, essentially from, when they're teeny, they kind of like, they eat for like 5 seconds and then they go off again and they're like, oh, I'm hungry again, but the point is they eat until they're satiated, whatever that feels like for them on a real intrinsic level, go away and come back. And it changes as they develop because that's just how it works. They naturally know how to help themselves grow.
It's like nobody has interrupted their hunger and fullness cues.
No.
They don't know what that is yet, right? Where it's like an intrinsic thing that they just know, just like a baby, when they're full taking their bottle, even if it's just 4 sips, they push it away. They just know. And like some of like the best like advice too that was ever given to me, because of course I've got a 1, 3, and a 7-year-old, so I'm in all the ages. And my 3-year-old just turned 3. It's like if I get one good meal out of her a day, perfectly normal, right? If the other days she sits at it, she looks and picks 2 grapes, that's going to be okay. Because when the girl is hungry, she's knocking at the pantry door.
Right.
It's the same with like even like the 7-year-old or going into like middle school, high school, there is so many like different growth spurs and all of the above, right? You continue to grow, right? And it doesn't matter if they decide to eat a full sub and another full sub 10 minutes later. That just means that they're growing and they're listening to their body.
Right. They're hungry.
Right? Yeah.
Well, and I think part of school age children, part of the problem is we at K4, maybe 5, first grade, we immediately put them on an eating schedule.
Yeah.
And I mean, yeah, they need, you get your food in, but like part of that disruption to hunger and fullness is that schedule.
Sure.
Right. I mean, to some degree, that can play a role in there, which again, good or bad, right?
Yeah. And that's where we're trying to normalize. What do we see as normal, right?
Mm-hmm.
Yeah.
What's normal is what we've been doing for 100 years now. Unfortunately, it just keeps carrying over, and hence why that idea of diet culture is pushing now to even more and more kids, right? Because it's becoming so normal to to ridicule a 3-year-old for how they look, or it's almost like parents, and this is things, I don't know if you notice this as well, there's almost a level of bullying, like, oh, we need a bigger size shoe because my 2-year-old's foot is too wide. Like, why is that a comment? Or, oh, you stuff like that, where it's just like, oh, you're so big. You're such a big kid. And it's like that type of language, I think all of us as human beings are very used to that, but it's not okay.
Right.
I mean, I've had family members bully, like infant to toddler age, because it's oh, you're so big, you're so using that word big, and it's just it's really uncomfortable.
Or being trying to be like playful and being like, well, she's the chubby one.
Correct.
She's the short chubby one or whatever, right?
And the comparing, like comparing, like
these kids internalize this and then see that as I am chubby, and therefore that's their belief system then.
Correct.
And they live that out,
right, whether or not they can articulate it or not.
Right.
Do you know what I mean? I mean, because even as adults, it can take some serious therapy before they realize, holy shit, that was said to me 14 years ago, and I didn't think that has been sitting inside of me.
Oh, absolutely.
Sometimes we bury this stuff, but we're still reacting to it.
Yeah.
Right.
What are the common things that you see, Jen, like phrasing that you'll hear kids tell you, like, their interpretations of, what I'm saying?
Of like different foods, or just
whatever language they're picking up on, and when they kind of maybe tell you about it, you know what I mean, about what they think about certain things.
Definitely about the food. It's like the big terms of like healthy, unhealthy, picking up on those diet things of like the low carb,
which is so weird, like to have a kid even say that. Like, do you even understand?
Like an 11-year-old saying, I'm going to the gym. Stuff like that, where it's just like, when I was that age, like healthy, like those were not words that were in my language. Sugar, none of it.
Eating clean is another good one. And that is like, what does that even mean? Right.
You
like,
washing your food.
And I always have to be like, what's your interpretation of that? And it's
totally,
like, oh, I only eat, fruits and vegetables, or it's like, or like you kind of said, I watch 11, 12-year-olds. I'm doing YouTube videos with workouts, like in my room. Like, oh,
go outside and play. Like, that's just so weird to me. How parents are allowing their kids to do this. But you have to figure it's within the household. I mean, you've talked with parents too.
With the household.
Yeah.
I mean,
well,
and of course there's school, right? There's things that come from school, but also a lot of it comes from the household.
Well, I think the thing too is that we have to keep remembering that like kids are not mini adults.
No.
Like kids are kids, and they're like, you want to encourage play because it also helps the brain.
Right.
It helps coordination. It helps their own creativity. They're playing with the right and left brain, like the development of these skills and abilities, instead of, making them into, or trying to get them to develop faster, right?
Mhm.
And understand it, just get it, right?
Nicole, there are 2 points here. Parents don't have the time to do all of that, so I think they want their kids to grow up faster.
Mhm.
And so they put them in a position to be like in it, because then they can work, they can, do all the things. And second, like, you talk about, brain development and all of those things. Do you know how many books are out there that tell you exactly how to raise a child and the things to eat and no TV and no this, whatever?
Mm.
It's horrifying how we've like made raising children and the language we use and the things we do with them like structured like a script almost. That's what it feels like. And then I think, and correct me if I'm wrong, but it seems like parents feel ashamed or embarrassed when the minute they let their kid watch TV or have a fruit snack or whatever off of whatever these books are saying.
Oh, sure.
Always
Sure.
justification, like, I don't have time, so they have a fruit snack, but I never let them do it otherwise. Right. There's always a justification, and it's like, why?
Right. Oh, they've been watching TV and it's just because of this. So, you know what I mean?
Yeah.
It's like there's it's instead of raising kids and being true to yourself and understanding like I got a lot on my plate. They're watching a show. I'm doing the dishes.
Sure.
That's okay. There's this like weird, I have to, justify why I'm doing that to other people.
Sure. Sure.
Why?
Yeah.
It's really weird.
Yeah.
Going with the whole growing up fast thing too, a lot of things I'm also starting to see are with the sports. Like I feel like the sports for kids are getting so much more competitive at a younger and younger age, and there's
crazy.
The demand, right? You want to be the fastest, you want to be, you want to be the best at everything, and it's kind of like that soccer mom persona of yep, I can only let my kid eat such and such thing because it's healthy and it's going to make them be the best athlete. Well, and it just is, it's draining for the kids, and hopefully they love it.
Yeah.
However, there's just this other aspect to it where, so much pressure for these kids.
Well, and I think when you look at kids with actual eating disorder diagnosis, as someone who takes the young adults, the 20 somethings and the athletes of that group, I've had multiple tell me, I'm not going back to my sport. I only did it because my dad made me or my mom made me over these few, and they hate whatever their sport is, but they've just been doing it for 15 years because they're basically forced.
I was just going to say they're forced on some level, definitely. But then that's the thing though. It's like, because I work with adults now who did things in the past to such an extreme level that they're so afraid of like moving or getting into any structure because they don't want to go back to how horrible something was. It's the same as a child. Like, don't we want to set them up to enjoy, the competitive thing I think is a bit much, honestly, because it's like, are we trying to tell them that it's best to always win and be the top of everything?
Kinda. I mean, if you want
versus collaborating, and I don't know,
to go to the Olympics, I mean, you're starting them at 3 years old and like winter sports, skiing, that stuff. I mean, you're not doing traditional school. You're not
right.
You know what I mean? Like I mean, yeah, that's great. They'll probably be good enough. Maybe they go to the Olympics. That's cool. But like, what are you taking away from them?
Correct.
In terms of life.
That's right.
Childhood.
And how is that like, what kind of a person does that create?
Right. Right.
And that's a concern I see too all the time.
Right. Now, recently you had met with the patient, but also the set of parents without the patient, where the parents were very concerned about the type of foods that he was going to be eating.
Yep.
And that to me is, I mean, you came back, we both were just like jaw dropped, very alarmed. Can you, like, what was that? What did you experience with that?
Yeah. So again, had a consult and the patient was a little bit timid. They didn't feel like the patient would be able to speak to a dietitian right away. So I spoke with mom on 2 separate occasions, kind of got the good background. And it was like, well, I wanted my kid to eat healthy, was also very active in hockey. And so there was the sports aspect. He wanted to be very good at sports, and the same thing. He wanted to be the strongest and the best at what he does. OCD played along with this, but it was just the fact of having to talk to mom and say, it's okay to have regular milk, but on this level, it was even, it's okay to have your, child have sweetened almond milk. It was right down to, we had to kind of go through the grocery list and switch the things out for this child to get the right amount of nutrition for growth. Definitely saw there was stunted growth.
But yet we're trying to be healthy.
And
there's the irony, right?
Yeah.
Well, and there's that whole, those skewed concept of what health means, which we talk about so often.
Yep.
It just makes me feel sad.
I mean, that's so yucky, right? Like,
yeah.
It's almost like failure to thrive or stunted growth in adolescence, things like that. It's almost like those aren't even a naturally occurring thing anymore. It's 100% a cause of who's in charge of that child.
Yeah.
In a sense, at least that's kind of how it's feeling sometimes, where it's like, what makes you think that it's a good idea to give almond milk to a 1-year-old or no cow's milk? With this whole concept, obviously I'm picking on milk and everyone knows my feelings on dairy. This whole concept of, why are we drinking milk from another animal? Like, so are you telling me, you adults, that you're going to go drink breast milk?
Right.
That's what I'm hearing you say.
Right. That's the only thing that actually makes sense.
That's what makes sense then, right? Yeah. That's what you're telling me. So you're drink a nut water instead of the cow's milk, which we know we can digest, we know is totally fine, or goat's milk or whatever.
Right.
It's just really weird to me.
I know.
That was my frustration with working with adults and kids.
Yeah.
Or rather, working with kids is working with the parents who have these diet culture rooted beliefs that are literally destroying their children.
Yeah, no, totally and completely agree. 100%.
Like, there's a generation of kids that are destroyed.
Yeah, I would agree. I would
Not
agree
just from
completely.
COVID, but because of these weird health things that are going on. And the professionals, parents, for whatever reason, sending their kids to weirdo professionals to do intermittent fasting at age 14.
Nope, we can't even talk about that. Nope.
Right. Right? No. I mean, have you seen that? I mean, are you seeing that kind of stuff?
Like, so let's talk like those Everly well tests, the IgG testing.
Oh dear.
I've definitely had to work with kids that have been told, oh, I was high on this, and now completely cut out of their diet. All of the above. Yep. And speaking of COVID as well, I mean, that was another thing too. A lot of that disordered eating disorders came from, school shut down.
Yes.
I was in sports. I was in choir, all of these things. And the world shut down. Those kids are now at home, surfing the internet.
Oh gosh.
Media.
True enough.
All they see is, I want to look like this now when I go back to school. So we did see a lot of that.
Well, and why are these kids not able to be at home without their school and their sport? I mean, I don't understand. Why can't they go to their, wherever in their house and get a board game, play with this, do this, that? I just don't understand why that's not occurring. And
why there's that much social media, why there's that much time being spent on a phone.
Right.
Getting information. I think those brains are so,
Spongy.
Yes.
Yep.
Jeez. So again, our time has gone by so fast. See how easy this was, Jen? Yeah. So what would be like 3 things you could leave parents with?
Oh man. I guess the number one thing is just how to talk to them about foods. Before you start to think about, or you're about to say, well, that's unhealthy, right? Think about how that is going to impact your child. I guess I am talking a little bit more on, the child side, smaller kids, but let's talk about like that cupcake, right? It's quick energy. You can talk to kids about that. It's quick energy, and how if you add something else to it, then you're going to have a little bit longer energy. It's kind of like the swing aspect, right? You have a cupcake and you're swinging really high, and then all of a sudden you kind of stop because you lost your energy, right? You add something to that, you're going to be able to swing longer and higher. So it's just kind of on how to talk to kids about foods versus, oh, we're not going to have that because it's unhealthy. Well, let's talk about what it can do for us, instead of what it cannot do for us.
Awesome.
Right.
So that would be like one of my bigger takeaways, is just kind of being more self-conscious about how you talk about food. Being that example, right? Let's make a little bit more normalized, where let's make a meal and sit down together when possible. Let's not make the kids something separate and have, parents are going to eat something separate. Let's all sit down. Let's give it a try, So it's just that exposure. The kids aren't going to like what they haven't never had. And
No, of course.
Like, oh, you didn't like carrots last year. You still don't like carrots. I'm not going to give them to you. That's not, you just have to keep
trying.
Going.
Yep.
Keep
trying.
Yep. I guess lastly is like, again, it's a different time. There's so much, the diet culture, the social media, everything that you hear. It's just talk to your kids about it and kind of debunk some of those myths, those theories, right? And just kind of be more aware. I think too, a lot of times when I have talked to parents, it's like, I don't know what happened, but all of a sudden my kid lost 20 or 30 pounds. But now when I look back on it, they were only eating 4 foods.
Right.
So it's just kind of being present and just, watching out for each other, I guess.
Yeah.
So,
it's so hard to see.
Yeah.
I know.
It's
It
hard.
is so hard to see.
Really hard to see.
Yep.
And it probably, obviously it makes you act differently towards your own kids, right? Like, you're so exposed to it, you do things a little bit different, right? And so I think the hope is, right, like to be able to,
and I'm no saint either. I still get caught up in it too, right?
Yeah, we all do, right?
Yep. And it's just one of those things. It's like, oh, take a deep breath.
Yeah, right.
It's all right.
Right. Exactly.
Just because your kid does something against the grain or has a cupcake or whatever, it doesn't mean you as a parent are doing something wrong.
Right.
Or because your kid is growing out versus up at a certain point, that's
also
okay.
evolution.
Let it happen. It's
what it is.
You can educate them as you go.
Yes.
You can provide them fruits and veggies, but let them be kids as well and have candy at a sleepover or whatever. Let them be kids as well.
Right. Agreed.
Yeah.
Well, awesome, Jen. We really appreciate your time. And yes, we will put all of your contact information into the podcast notes as well, so everybody will be able to find you.
Perfect.
Thanks for your time.
Bye.